Rippling or wrinkling of the implant. Have you ever noticed that? Sometimes you could be at the pool and you see somebody that has nice breasts and you're thinking, do they have an implant or not? You know where to look? Right here. So when they're laying down in their chair and they're going to get up and they're going to reach for a drink or reach for a book or something, if you look right there and you see rippling, that's rippling from an implant. The second place you can see rippling, not as commonly, but in the middle part. If in your cleavage you see rippling, that's a lot bigger problem. So let's break it down. Rippling comes from the implant and the outer shell that's rippling. More common in saline implants than it is in silicone. That's why we really just use silicone now for most patients. But you can still see it in silicone implants in patients that are particularly thin. They don't have a lot of coverage of the implant to camouflage that rippling. Or their implant is placed underneath the gland. That means it's closer to the skin. And patients who have not very good tissue there can show rippling. So if that's a problem, we will go back in, remove the implant, and we'll place it under the muscle. That'll camouflage. Then we can also add a little bit of fat and do some fat grafting. That will also build up the tissue to hide that rippling.